Hey, what's up, guys? Today we'll be talking about factors that affect cardiac output. What are the factors that affect this cardiac output that we always talk about? Now, we say that cardiac output is the amount or quantity of blood from each ventricle, and this is also the quantity of blood that flows through the circulation. Okay, that blood is responsible for transport of substances to and from the tissues. And cardiac output is the most important factors in CVS. Now, because rate of blood flow through different parts, okay, this is because rate of blood flow through different parts of the body depends upon what cardiac output. Okay, it is the most important factor in CVS. Right now, we'll be talking about what are the expressed values of this cardiac output. Cardiac output is usually expressed in three ways. I will be discussing two ways: the stroke volume. This is the amount of blood pumped out by each beat, okay? As a stroke, 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 okay? Our normal volume is what 70 milliliter. That's between the average between 60 to 80 milliliter. That's stroke volume. Then how about the minute volume? We say that minute volume is the volume of blood pumped out by each ventricle per minute. Okay, normally is what 5 liters per minute. Okay, you get to see that heartbeat is between 72. So when you times 72 by 70, you should find approximately, that's heartbeat in a minute, 72. Approximately these 5 liters that we are talking. But we'll talk extensively on that when we are making our video on calculations of cardiac output. Now, the factors that affect cardiac output: ventricular filling. The amount of blood that enters the ventricle will be the amount of blood that will be pumped out. So more blood, more cardiac output. Now, during diastole, which is determined by venous return, the heart has a built-in mechanism that normally allows it to pump automatically whatever amount of blood that flows into the right atrium into the veins. Okay, flows into the right atrium, into what? The left ventricle, the right ventricle, into the veins. Now, this is called what? Frank Starling's law of heart, stretching the cardiac muscle by increasing in venous return, resulting in what? Greater cardiac output. Now, the sympathetic nervous system also has an effect on the cardiac output. Now, so that the effect of sympathetic nerve fiber supply to the heart. Now, we get to see that sympathetic stimulation increases rate and force of contraction of the heart, okay? Now, it also increases what? The volume of blood pumped. Because if the sympathetic nervous system is active, the passive 70% or 80% blood that flows from the atria to the ventricle will flow, and the atria will also contract so that 20% and 30% will flow into the ventricles. Now, this also increases what? Cardiac output as much as 2 or 3 folds. Okay. Now, decrease in sympathetic tone with what? Decrease in cardiac output. So sympathetic nervous fiber supply to the heart is directly proportional to the what? Heart output, cardiac output. Now, we also have effect of peripheral resistance. We say that under some normal conditions, the long-term cardiac output level varies reciprocal with the changes in total peripheral resistance. That's the Ohm's law. Cardiac output is equal to arterial pressure over total peripheral resistance. Okay, now you see that here cardiac output is directly proportional to arterial pressure, while it is inversely proportional to peripheral resistance. When you resist, you have a less flow. Okay, that's the summary. Other factors that influence cardiac output: we have the hypertrophy of the heart, we have heart disease, we have decreased blood volume. Okay, so that, guys, I think we are done with the factors regulate cardiac output. So see you guys in the next. Bye for now.